Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 731,450 confirmed cases of COVID-19 in Canada and 247,564 cases in Ontario. Chatham-Kent has 1,046 cases and Sarnia-Lambton has reported 1,730 cases. Michigan now has 544,311 cases, with 27,971 cases being in Detroit. Today we are reporting 99 new cases of COVID-19 in Windsor and Essex County. 11 cases are close contacts of confirmed cases. 11 cases are related to outbreaks. 1 is community acquired and 76 cases are still being investigated. We have had 11,546 cases since March. 9,268 people are now resolved and 1,990 people are active cases at this time. 110 confirmed cases are currently in the hospital and 16 people are in ICU. A further 169 suspect cases of COVID-19 are in the hospital as well. We are reporting 8 additional deaths today. 5 people are from long-term care and retirement homes. A man in his 70s, a woman in her 80s, 2 men and a woman in their 90s. 3 people are from the community, a man in his 60s, a man and a woman in their 80s. Our community has lost 288 people to COVID. There are currently 50 active outbreaks in Windsor and Essex County. 23 are in workplaces, 19 are in long-term care and retirement homes. There are 6 outbreaks in our hospitals and 2 community outbreaks. Vaccinations took place at another retirement home yesterday. We have now completed first visits of all of our long-term care and retirement homes. Second doses will begin on January 28th, and we will continue to vaccinate remaining residents as vaccine becomes available. We were asked yesterday about charges laid by our enforcement officers. So since November 1st, we've had 513 complaints resulting in 65 notices of violations being issued and 23 charges. The last charges were laid the week of Christmas. Our enforcement officers are also participants in the blitzes that occur with the multi-ministry teams, and will continue to be out there enforcing the Reopening Ontario Act as well as the Health Protection and Promotion Act. Despite the rollout of vaccine, please continue to follow the public health measures. Stay home. Stay home if you're sick. Limit your close contacts to your household members only. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze, and download the COVID Exposure Alert app at canada.ca. If you have any symptoms of COVID, no matter how mild, please get tested by calling or booking an appointment online. COVID symptoms include fever, new or worsening cough, a barking cough, chills. The testing and assessment centers are able to accommodate a same-day booking and testing. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Recognizing the time, I'll just dive right into the epidemiological summary for this week. So starting off from the global picture of what's happening with COVID-19 cases around the world, and I just included 4 countries, recognizing that more countries if I include, it just makes it more difficult to interpret. So right now, as we can see, UK and US continues to lead with the highest case rates in the world. UK had seen a significant spike based on the variant SARS-CoV-2 virus that they have seen, and now they're trending downwards. Canada has seen a spike that went up, and now we're also starting to see a trend going downward and relatively stable as in the country. Looking at the death rates in around the world, similar picture. UK with their huge spike are now currently have higher daily death rates per million population compared to many of the other countries in comparison, including US, France, and Canada. Canada continues to have a stable trend, and it's stabilizing as we continue to deal with the pandemic. Focusing now in the province of Ontario, we have seen a spike in daily number of cases going as high as up to 4,000 cases, and now it's starting to show a downward trend going down to 2,500 and less cases in some days. And overall, when we are looking at the trend is moving in the right direction in the province. Similar picture, what we can see in the Windsor-Essex, that we have seen a huge spike, a very sharp increase in the month of November and December, and right now the trend is stabilizing and showing some early progress with little by little case rates going down gradually every day. Looking at the cumulative cases, so right now, as I mentioned, November, December, we have seen a huge spike in the number of cases, and we have yet to see that flattening, but we are starting to see some initial sign of flattening in this curve. With respect to the deaths in Windsor-Essex, a similar picture, which is again, it's a lagging indicator. When we see more cases of COVID, it results in the death of people. And similarly, with the high increase in the number of cases, we have seen a huge spike in the death in the month of November, in the month of December mainly, and then continuing on in January. Looking at Windsor-Essex case rate by reported week, so this is a week over week comparison, and the week generally ends on Sunday. So this particular rate is the data from this week is not captured, but will be reported next week, and we hope to see with our cases this week there will be a further trending down of these case rates in Windsor-Essex. Comparing our case rates with the rest of the province and the southwestern Ontario, we can see that we are still above the provincial average as well as the southwestern Ontario average, but all of the indicators are pointing a downward trend in the province, in the southwestern region, and also in Windsor-Essex. Looking at our wastewater surveillance data, which is the red line, and we continue to see a steady decline, which for the most part correlates with our case counts as well. So if we try to do another projection based on the wastewater surveillance data, it seems like they all are aligning well. We have starting to see an original case rates declining in our region, as well as the wastewater surveillance data showing a decline in the case rates in the region, which is all a good sign. But again, reminding with caution that these are all early indication, and we'd like to see the trend continues. Another question that's frequently asked, yes, so case counts are down, is there any impact on the number of tests? So what we can see is in total so far in Windsor-Essex, 229,125 tests were completed as of January 16th, and for the week ending on January 16th, our percent positivity was 8.7%. This is a dip from the last week, which was 11.7%. So there's a significant decline there in the percent positivity. And last week, approximately 11,196 tests were completed. This is compared to the same number of the tests from the week before, and we continue to see a decline in the results coming back positive. So looking at the percent positivity by age, breaking it down between 0 to 17, 18 to 34, 35 to 64, and 65 plus, the percent positivity continues to stay high among the 0 to 17 age group. And as I explained last time, the likelihood of them getting tested and the reason for them having a high percent positivity, but they're all showing a decline overall in terms of their percent positivity rate. This is just another way to show, focusing on September all the way up to present. This graph shows the daily number of tests by age group, and breaking it down further in terms of who's getting tested, which is a similar picture. And this one focuses just from September to present. So this particular graph shows you the percent positivity by forward sorting station area, which is another way of to saying that your first three postal code digits and how it corresponds with the percent positivity by the in your particular area. And as we can see, between January 13 to January 19, which is the last 7 days, data that we have, it shows that which areas had the highest percent positivity in Windsor-Essex County. So the next slide is an animation, which unfortunately I cannot play, so hopefully we'll try to figure out a way to play it next time, but it tends to show you how the percent positivity changed from April all the way up to last month. This graph looks at the percentages of test results, all test results that are available within 1 and 2 days of someone getting tested using a 7-day average. Approximately only 9.5% of tests are being processed with results available within 1 day of being tested. This is very low. With the lab capacity ramping up in Windsor-Essex directly, we hope to see that there will be more progress in this area, and we should be able to get our lab results back much quickly. When we are comparing our health region using the 7-day average, we are close to the bottom of our test turnaround time in 1 day. Similar comment, like as we are building the lab capacity here in Windsor-Essex, we hope to see further progress in getting our results back. Looking at how long it's taking a test results to come back for a person tested in Windsor-Essex. So this is a new graph that we have added, and it shows that Windsor-Essex currently, it takes almost 2.5 days for a person to get a test results back. This is lower only to 5 other health units in the area, including Lambton County. Looking at our overall case rates between the various regions of Ontario, we are currently as the second highest rate in Ontario. We have surpassed Toronto. Even though Toronto has a lot more cases than us based on our population size, we are seeing much higher cases than in most areas in the province. Focusing on municipalities by case rates, and this is all of the cases that we have seen since the beginning of this pandemic, and as recent as last week, with the overall case rates that continues to be in Leamington and Kingsville area, followed by Windsor and the rest of the municipalities. Just focusing on December 1st to present, and right now the similar picture, Leamington, Kingsville continues to lead the case rates, followed by the city of Windsor, Tecumseh, and the rest of the municipality. Overall distribution of cases since the beginning of the pandemic, city of Windsor continues to have slightly more than half of the cases in the entire region, followed by Leamington and Kingsville having a significant number of cases, and the rest of the municipalities at a relatively stable position. In the last 30 days, a similar picture, but less cases in Kingsville area. And then in the last 7 days, a similar picture with bulk of the cases coming from Windsor and Leamington, and rest of the municipalities are relatively stable. Breaking it down, all the cases between age and sex distribution, we see that overall our majority of the cases continues to be in the 20 to 29 years age range, and it hasn't changed a lot in the last 2 weeks, and it's slightly lower. We have seen some increase between the ages of 50 to 59 in the last 2 weeks, but hoping that it will all trend back to where we were before. Exposure history by reported date. So this helps to break it down by all the different exposure sources since October. And as we can see, the cases are coming from pretty much every direction, starting all the way from the close contact, household contacts, outbreak, and with a little bit of travel-related cases as well. But generally, it's related to outbreak, household contact, close contact, and a significant amount of community transmission we can see. Since the lockdown measures have been implemented, and we are starting to see a decline in the community transmission, and most of these cases are now looking more towards household contacts and close contacts. Similar data, but broken down by municipality from December to present. And as we can see, similar picture, similar trend. In some municipalities, there are more outbreak-related cases because of the outbreak in either in the agri farm or in any particular workplaces. And majority of the cases continues to be related to household contacts as well as the community spread. Active outbreaks, as we can see that we crossed more than 50 outbreaks recently. We're starting to see some of these outbreaks being rescinded now, but still with the region of our size, we have a significant number of active outbreaks in our region. When it comes to hospitalization and ICU utilization, we have far exceeded all levels experienced in the first wave, and even with the decreasing case counts, our hospitalization remains high. And all these deaths and hospitalization, as we know, it's a lagging indicator. So even though now we are starting to see some progress with our cases, but hoping that it will also help to ease some of the pressures that the hospitals are seeing right now. This is an overall 14-day average COVID-19 hospitalization, and as we can see, we have roughly 100 or more than 100 people hospitalized as a result of COVID-19 in our region. Day-over-day admission as a result of COVID, we can see that these numbers were really high, and we're starting to see a slight decrease in the admission data as a result of COVID. So where are we with all these cases? Almost 78% of these cases are resolved, and as you can see that there's still a bulk of the cases marked as unknown, but we can safely put that in the self-isolation category. When we are pulling the data, the unknown is the cases that are that with an ongoing investigation, and all of them are given the instruction to self-isolate. But when we're pulling the data, it still shows as unknown, so we can safely include the self-isolating versus unknown cases together as currently active cases, which is roughly around 2,000 cases in Windsor-Essex at this time. So we have reported number of deaths in the recent timeline, and as we have mentioned, sometimes these deaths are not reported to us on the same day. And when we initiate and investigate, we put all those deaths in these respective dates. And this is what it looks like, day over day, number of deaths in our region as a result of COVID. And similar picture, we have seen a huge spike in the month of December, pretty high death rates end of December, early January. And then looking at the most recent one with one spike, but generally we can see that that number is also trending downwards. Breaking it down by COVID-related deaths by age and sex, more female than male, and then generally the highest age group has the most significant outcome or more number of people dying as a result of COVID. 64% of them who died in our region were more than 80 years old. At our case fatality rate, is slightly more than the provincial average at this time, while our Ontario long-term care home rates are still below the provincial average. Looking at our day-over-day doubling time, we did pretty good in the month of September, October. We started to see a decline in the number of cases, or the doubling time in early November, December, and then continuing the trend in the month of in the last weeks. But now we are getting close to what the provincial and Canadian day doubling time looks like. Looking at our R not effective, which is right now currently stands at 0.77, and this has decreased from last week, which was at 0.99. When the R naught is less than 1, each existing infection caused less than 1 new infection. If lower, it means that our case counts are decreasing. However, we are seeing a stable number of cases, but in much higher volume, which is impacting our reproductive number. So in summary, the case rates in Windsor-Essex County remains higher than the provincial average, but it's decreasing. Our exposure sources are still distributed pretty evenly between the household contact, close contacts, and outbreaks, indicating that we are still having some community transmission in the region. We're starting to see a decline in that trend, and hoping that this is something that people can pay attention to and continue to follow the good public health measures as they've been doing it for the last few weeks. COVID-19 related hospitalization is still high despite us seeing a trend in declining the overall cases. But again, we know hospitalization and deaths are a lagging indicator. So if things starts to move in the right direction, we should expect to see a decline in the hospitalization and COVID-related deaths in our region. The number of active outbreaks still continues to be high, something that we are working with all the facilities, all the workplaces to get that under control and then get them out of the outbreak. Our day-to-day doubling time is also starting to show some improvement, and our median R not effective value is also trending downward, 0.77 as it stands, indicating a decline in the transmission in Windsor-Essex. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning. Just wondering, how long would you like to see these downward trends and lower case counts before the restrictions can be eased?
So some of these restrictions are, as the province announced, they like to have these restrictions at least for 28 days before they can revisit and look at the data and the numbers and how it would impact us. So I would assume the stay-at-home order is extended up until February 11th for our region and for many other regions. So around that time, we would expect that there will be further discussion looking at our case rates and then looking at our trend and see what's going on in Windsor-Essex before easing some of these restrictions. But again, these are all provincial decisions, and we are providing and sharing our data all the time with them.
Okay, and as far as the vaccine, is it frustrating that across the border in Detroit, they're expanding the vaccine rollout to teachers, funeral directors, people over 65, when in Ontario, the shipments are delayed?
Well, if we get more vaccine, we want to vaccinate everyone in our region, and it is a challenge, and I can understand that the provincial government and are really struggling to find that right balance of ensuring that the vaccines are allocated to the area to maximize the benefit and minimize the harm. So that will continue to be the goal, and we'll continue to work with them to roll out the vaccine as quickly as possible when we get enough supplies.
Okay, thank you.
Any questions from CBC?
Hello and good morning. I wanted to ask about school reopening and closing guidelines. Just wondering if there's been any firm criteria from the province or whether they've provided any data to back up their decision making.
Not to my knowledge. I haven't had any direct discussion with the province on the school reopening or closing at this time. I understand that the province has allowed some regions to open up their school based on their local epidemiology. Our local epidemiology still is pretty high, and we are seeing some improvement. And once we get to that level of when we can discuss our local epidemiology with the province, we'll be in a much better position to discuss this school reopening. At this time, I haven't had any discussion with the province.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. I'm sorry, I might have missed it. Did you say an average of how many tests were completed this week?
So last week we completed 11,000 tests, which is similar to the week before. So that's why our numbers with all these tests showing a percent positivity decline, it's a good sign.
Thank you. I missed that. Okay, that's all.
Okay. Any questions from the Windsor Star?
Yes, good morning, Doctor. I believe the last time you did your happy dance was the day when we had 0 cases. How are you feeling seeing this decline in cases?
Well, we still have a long way to go, and as much as I like to be happy about it, but I think again, we know how quickly it can change. We did very well in September, October, and then it quickly changed. So I think it's, I would still like to be cautious in being overly joyous. But I do like the trend, and I want to thank everyone who's following the recommendations to bring our case counts down.
That's all for now. Thank you.
Okay, and any questions from AM 800?
Hi, good morning. I was just wondering if Teresa could give us those numbers again on the enforcement and that I think that she was getting the number of charges.
So this is since November 1st. We have had 513 formal complaints that have come in, resulting in 65 notice of violations being issued by our enforcement officers and 23 charges. And when I looked back, the last charges were laid the week of Christmas.
Okay, so, and then I think you were mentioning that the health unit officers are still continuing to go out, and are they working with city bylaw officers and police, or how is the enforcement still working?
So our officers they continue to go out, and in many cases they are working with either alone or with enforcement officers and bylaw. And also we continue to be part of the provincial multi-ministry team where they have their own provincial enforcement officers working with local enforcement and doing blitzes across the province. So we were part of that initiative previously, and there are plans again, for that activity.
And I'm just wondering, are complaints still coming in at a continuous rate? And if so, what are the complaints that you're mostly getting? Is it for, improper use of PPE or, not having cleaning or sanitizing on site? What are you hearing?
So the complaints are sometimes around people not being screened, PPE, not wearing a mask properly, not physically distancing, and also indoor capacity limits.
Okay, so as of right now, because we're in gray, the indoor capacity limit, I would assume, would be like grocery stores and the essential businesses.
Yes.
Okay, and just to give people a heads up, if they do see something that they are worried about isn't in compliance, are you still welcoming them to call the health unit for complaints? And if so, how do they do that?
So we do have a health unit line. I'm looking at Mike to see what the call line number is, the extension. But they can call our health unit line. They'll be redirected, but we get complaints every day. And this is, pre-COVID times as well, that people who, have an issue with various places that we inspect, we follow up on them. So
Christine, the number or the extension is 4475.
4475.
Okay, thank you. And yeah, you were just mentioning that you're still welcoming people to call if they see something they're not comfortable with or they're worried may not be in compliance.
Yes, definitely.
Okay, thank you.
Any further questions from CTV?
No, thank you.
CBC?
Yes, hi. I noticed that today you announced a sixth outbreak at a hospital. I'm wondering whether you have any concerns there.
Well, obviously, we watch all these outbreaks very closely. We want to make sure that there is no ongoing spread of the disease, and sometimes it's challenging to contain the outbreak in many of these settings. And we are working very closely with all the hospitals to make sure that we get it all under control as best as possible. But it continues to be a concern for us to control these outbreaks in a timely manner.
Thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
Yes, Teresa, you mentioned previously that the rollout of the second doses of vaccines at long-term care and retirement homes will begin on the 28th. Today's the 22nd and you are finished. So I'm just wondering, what are you working on in the days between that second rollout begins?
Well, we are working on everything else and the vaccine rollout as well. So last night we presented our vaccine rollout plan to our Board of Health, and it's the overall plan that will be, released a little bit more in depth. We have a committee, a task force committee that will be meeting next week to roll out the plan or to, review the plan with that committee as well. This rollout plan requires more work, so that's what we're all working on, is the next step. So working with various stakeholders and community partners when we do get the vaccine and what their role will be, and trying to get all those plans in place, being ready and prepared to administer vaccines as they become available. And if there's an ability to vaccinate earlier than the 28th with first doses, we will. But because we do know that there are still some residents that need the COVID vaccine.
And with the shipment that you expect to receive in early February, will you be able to complete all of the second doses?
Yes, so our shipment will match our first shipment, and it was to cover all the retirement homes and long-term care homes. So we believe that the full shipment would give us what we needed for our community.
Okay, thank you.
And any further questions from AM 800?
No, thank you.
Thank you, everyone. Have a good weekend.